Hi. As you may already know, liposuction is my favorite procedure to do. And even though there are procedures that are more complex and demanding, such as a facelift or even underarm endoscopic breast augmentation, I enjoy lipo the most because from my end, it's a physical activity which I enjoy doing in a warm room because I keep the room warm. But from the patient's end, which is of course more important, it's an extremely safe event the way we do it. And that's because it's done either under local anesthesia with some pre-medication by mouth beforehand, or more commonly it's done under IV sedation. So you have a very qualified anesthesiologist who's basically serving as a bartender to take the edge off the procedure in terms of discomfort as well as your memory. And basically with IV sedation, the odds are extraordinarily high that you won't remember a thing about your procedure, and yet you're breathing on your own the whole time, so that risks relating to your airway and risks relating to blood clots, which we're going to talk a little bit about, are really negligible, I would say. And the other great things about it is that the scars are tiny and the recovery is easy. But we're going to delve into a little bit and talk about some of the details in preparing for liposuction, as well as instructions relating to recovery after liposuction. Preparing for liposuction. So when you think about any surgical procedure, and liposuction is a minimally invasive, I would say, surgical procedure, you're going to have tiny incisions with lipo, and that means a possibility, and we're going into the body. We're going into a space, filling it with fluid, and then sucking fat and fluid out, possibly using advanced technology to cause tightening. So all of those steps of numbing you up with injection under the skin and sucking that fat out can cause bruising. So in preparing, you don't want to be on medications or foods that will increase bruising. So that means you want to stop a lot of the supplements that might be good for you normally. So those are things, basically oil or fat containing supplements like fish oil or omega-3 should be stopped a couple weeks before. Also red wine, which has resveratrol, which thins your blood, would be best stopped. If you're very OCD about not having much bruising, I recommend that you stop having regular red wine 3 or 4 weeks before the lipo procedure. There are more significant things that really thin the blood in a more significant way, like aspirin or Motrin, and those we remind you we don't want you touching for a week before. But it's important to understand there are many supplements that we don't even fully know their action, and we recommend you stop them before the procedure, things like ginkgo. And then there are other things like garlic and ginger, and particularly interesting, I've learned recently about turmeric. Acts a lot like aspirin, so you should not be on those things before your liposuction procedure. So that might be some useful help. Now, in terms of the risk for blood clots, as I discussed, if you're having your liposuction with me, you're probably having it under IV sedation or even local anesthesia, and blood clots are exceedingly, exceedingly rare. We're also taking full precautions during the procedure to prevent them. But nonetheless, we request that our patients having any form of sedation with an IV stop taking birth control or any hormonal supplements for 2 weeks before and 2 weeks after surgery. And that's because it's well known these things could increase the risk of blood clots. Similarly, if you're coming from far away from a long plane or car ride, we want you to take for a car ride at least 24 hours to walk around, equilibrate in your body. And if it's a long flight with jet lag and things like that, we strongly recommend you take 48, but you must have a minimum of 24 hours between getting off the plane and having surgery. And again, this is for your safety. Thanks.